Hi, everyone. Thank you so much for letting me speak today. I'm really excited to talk to you. As was mentioned, the title of my presentation as in the program here is Representation of Men Who Have Sex with Men in CAHR Conference Abstracts, and I thought that was a little bit boring. So the question I'm really asking is, where are the gay men? So the presentation that I'm giving you today is based on a paper that I've been working on as part of my master's in public health at U of T. So that's sort of the hat that I'm wearing today for this presentation. And it is a work in progress, so forgive any sort of egregious errors or serious shortcomings, but hopefully it should be okay. So I have to admit that this past year was the first time that I had ever actually been to a CAHR conference. So I'm sort of new to CAHR conferences in general, and I think that I was really lucky to be able to go. And I'm also sort of new to gay men's health, specifically within HIV prevention work. And I'm only sort of now starting to understand sort of all of the complexities of what gay men's health and HIV prevention is within sort of the broader HIV sector. And I did want to mention that I really appreciate all of the work that people have put into bringing CAHR conferences into existence. All of the research that's been done is incredible, and the caliber of research and the amount that I witnessed at CAHR was really incredible. So this presentation is not necessarily to say that CAHR is, that there's a big problem with CAHR, but just to ask some questions about CAHR itself. So for those of you who haven't been to CAHR conferences, you probably will, if you ever do go, you'll see lots of presentations. Lots of presentations and people speaking. There will be lots of poster presentations as well, and some pretty swank lunches if you're willing to sit through a sort of a pharma presentation kind of thing as well. So there's a lot to take in over the few days that the CAHR conference is. And when I went to the CAHR conference this year, I really went sort of asking myself, or sort of to look for research and things that were really addressing gay, bi, two-spirit, and other men who have sex with men. That was what I was going to see. That was what I was looking for. And when I left the conference, I ended up asking myself, where are the gay men? So, oh, geez, I don't know how John Baird got up there. I was just looking for pictures of Pride in Ottawa. So I really, when I was there, I really went looking for gay, bi, two-spirit, MSM content, and I didn't really feel that I got it. And so that sort of, made me ask some questions a little bit. So just to review, Chris just gave some statistics about HIV and men who have sex with men in Canada. Mine were a little bit different. Mine are probably a little bit older. But I think that these are really important numbers to keep in mind as I give you my presentation. So I'm going to stick with my numbers that are a little bit different from Chris's, as I said. But about 51% of all people living with HIV in Canada as of 2008 were men who have sex with men. And based on national HIV estimates, about 47% of all new cases of HIV in Canada were among men who have sex with men. So we, as a group of people who fuck other guys, are about half of the HIV epidemic in Canada. I think that's really significant. And based on that, I sort of went to CAHR expecting it to be pretty gay. But I didn't really feel that it was very gay. I was sort of ready to camp it up, and I sort of toned it down a little bit. So I also went into the conference just having read a report by the MSM Global Forum called Coverage of Four Key Populations at AIDS 2010. And in that report, they basically quantified the program coverage of men who have sex with men, people who use drugs, sex workers, and transgender people. And they basically concluded that there is a gross underrepresentation of the key populations across the 2010 conference program. So one of the things they did is they really distinguished between exclusive abstracts and sessions, so that we're really actually focused on sort of gay, bi, two-spirit, men who have sex with men, and those who just sort of, where sort of queer men were lumped in with other groups and compared or sort of contrasted. And what were their findings? Well, across all sessions, so that's like all abstracts, bridging sessions, commercial satellites, cultural activities, global village sessions, men who have sex with men were exclusively sort of represented in 2.6% of the entire conference. So it was not very much. And the other populations were also sort of really poorly represented. People who use drugs, 4.5%, sex workers, 3%, transgender people, 1.1%. And they concluded, and they sort of stated that program coverage of key populations at each IAC must seriously and respectfully reflect the epidemiological burden and on-the-ground needs. And so I think that this is a question that we have to ask in Canada as to whether our sort of canon of research is doing the same thing. They also said that all HIV professionals and health workers have to have the skills to effectively respond to HIV prevention, treatment, care, and support for the populations that are listed there. So we have to ask, do ours in Canada? And they mentioned that as a sort of a premier venue for HIV research, that the International AIDS conference, it can serve as a vehicle for change. So it has the potential to influence knowledge production, policy, advocacy strategies, donor responses, research foci, and I think that the same goes for CAHR. So I sort of thought to myself after I went to the CAHR conference, if the MSM Global Forum can do it, why can't I? Probably lots of reasons actually, but we won't get into those. So a little bit about the CAHR conference itself. It's been held annually for the past 20 years. Right now, there are over 600 participants who go per year. And CAHR sort of has declared itself an advocate for HIV research. And a lot of the CAHR's history has to do with advocating for HIV research. Their tagline, or one of their taglines, is that they are the voice of Canadian HIV/AIDS researchers. And in a recent report that they released, they said that the history of CAHR is synonymous with the history of HIV research in Canada. So partly, when I was going into this project and asking these questions, one of the questions I had was, is this really about CAHR, or is this actually about, HIV research, period, in Canada at least? And what does this say about where HIV research is and how gay, bi, two-spirit, and other men who have sex with men are represented? The sort of structure of CAHR resembles more of the scientific program of the International AIDS conferences, on a smaller scale, of course. There are four sort of basic disciplinary streams. Now, this has changed. The four used to be basic science, clinical science, epidemiology, and public health. But social sciences is now a stream as well. And mostly the conference is oral and poster abstract presentations. There's about 300 a year, and there's some satellite events and social events. So I had a lot of questions when I started this project. A lot of them were inspired by the MSM Global Forum report, and a lot of them were my own. A lot of them were the ones that my professors had of me, so lots to answer. But, the basic ones that I wanted to ask were how many abstracts, just in terms of numbers, so oral and poster abstracts, actually addressed or included gay, bi, MSM men? Within those abstracts, what were the main topics that were addressed? Sort of what does HIV research look like among gay, bi, MSM men? And how are those populations portrayed? So, in other words, what was it about the feeling that I left CAHR with that didn't make me feel so good? I really wanted to be able to answer that question and know why. So, and why did I do this research? Why did I ask these questions? First, because I think without good quality research, evidence-based practice is impossible. I mean, that's obvious, but evidence-based practice is something that we talk about a lot. We want to do good HIV prevention work, and in order to do that, we do need to have good evidence. This is what's being asked of us. So, I think we need to know what's going on. And also because I think underrepresentation can perpetuate and exacerbate injustices. So, I think that it's an injustice that gay, bi, and other men who have sex with men suffer so heavily from HIV. And I think that part of addressing this injustice is making sure that there's enough high-quality research that goes into directing our efforts. And I also wanted to encourage discussion within the HIV sector and among sort of our community of gay, bi, two-spirit, MSM men about what we think the research should look like. So what is it? What are CAHR conferences looking like, and how do they represent queer men, but where do we want them to be, and what do we want that research to look like? So sort of as a disciplinary reflection or taking stock. So what did I do? The Canadian Journal of Infectious Diseases and Medical Microbiology publishes all of the CAHR abstracts presented at CAHR conferences online for every year. So if you go to the CAHR conference, it's made my job really easy. You can see all of the conference abstracts. So it really gives you a good sense of what's happening. And I looked at 5 years of CAHR conference abstracts for my sort of overall analysis. And that was 1,605 abstracts representing all poster and oral presentations from the CAHR conferences over those years. So first, what I had to do is figure out which abstracts actually sort of addressed the populations that I was looking for. So first, I read through all 1,605 titles and selected the ones that I was sure, would probably address what I was looking for. And then I did keyword searches as well for as many keywords as I could to find all the articles that could possibly address sort of gay, bi, queer, two-spirit, and other men who have sex with men. So I mean, like, one of my terms was men. Like, I did a lot of reading to find every single article that I could that addressed that population. And I also, but basically what I did is I wanted to select only those articles that actually addressed Canadian context, so not necessarily international research. I was curious about what was going on in Canada. The only articles that I really didn't keep for this analysis were articles that sort of mentioned gay by MSM, but only that, everyone thinks that HIV is all about gay by MSM men. That didn't really count for me. So the first coding piece that I did, I wanted to look at the three different tiers of how gay by MSM men were represented. So first of all, exclusive abstracts. So those that were focused solely on gay by MSM populations within Canada. Then I looked at non-exclusive abstracts. So those were ones that mentioned gay by MSM men. But not only did they mention them, they also sort of reflected back on the findings that were pertinent to gay by MSM men. And lastly, I did also look at those that sort of mentioned queer men as a demographic category, but that didn't really go anywhere beyond that. So they just sort of said, 75% of the people in the study were identified as gay, but that was it. They didn't actually talk about any findings that were relevant. So that was sort of one piece that I did. The second, more intense analysis that I did was through a qualitative analysis software called NVivo, and I looked at 45 abstracts that were exclusively focused on MSM for just the past 2 years of the conference, and I wanted to look for things like methodological information, major topics and themes. And it's interesting because Chris Boudram recently said that there were 39 research projects going on among MSM, and that's how many I actually found over the past 2 years of the CAHR conference. So, like all first dates, I'd like to start with some disclosure. First of all, abstracts don't necessarily tell the whole story of what's going on at the conference, right? They're only a piece of a presentation, not everything that is being said. So I want that to be clear. And also, CAHR is not necessarily actually completely reflective of all HIV research in Canada. So, what did I find? Over 1,605 abstracts that I looked at in 5 years, 87% of those abstracts made no reference to men who have sex with men in any way at all. 7% of them exclusively addressed men who have sex with men, 3% non-exclusively, and 2% made demographic mention of MSM. So those categories are mutually exclusive. So them's the numbers. I was not really surprised having been to the CAHR conference, but I think it's really, it's a moment just to reflect. 87% of the abstracts did not mention us. So this is sort of what it looks like over 5 years. One of the things that I thought was, really sort of striking was that in 2007, which was just the worst year if you ask me, 93% of all abstracts did not even mention the words or our population at all. 93%, and we are half of the HIV epidemic in Canada. I think that this basically means that within the conference, a lot of important aspects about our experiences, our communities, and the specific populations within our communities are really just basically ignored. So within the 119 abstracts that did exclusively focus on gay, bi, MSM men, this is the breakdown of where they were at the conferences. So 2% were in the basic sciences, 7% in the clinical, 51% in public health sciences, 40% in social sciences. One of the things that people have said, well, how many would you expect to have in basic sciences, for instance? It's about cells and biology and body fluids and that kind of thing. But there were actually a huge number of articles that referenced the cohort of Punwami sex workers from Nairobi as a source of biological sort of tissue samples that were really interesting. And I do feel that there's something a little bit messed up about the fact that, that probably about 50% of all the samples that are being used in the basic sciences are coming from gay, bi, MSM men, and only 2 abstracts actually mentioned gay, bi, MSM men exclusively. Like, I think one was about semen, and I forget what the other one was about. So Terry sort of talked about the terms that we use to describe populations of men who have sex with men. And this is sort of what it looked like among those exclusive abstracts. Note, these are not mutually exclusive, so some abstracts would use multiple terms to refer to the population. This is, I think, a really important thing to talk about, because basically when we think about language, what this does is it will influence the decisions that we make around the language that we use in outreach and advertising campaigns and what sorts of environments outreach is done in. For instance, if the majority of men who have sex with men becoming HIV positive don't identify as gay or bisexual, then campaigns, ads, and messages that use gay linguistic and cultural references might not be really very effective. But if the MSM that are most at risk for HIV do identify as gay, generalizing messages that don't reflect their identities or their cultures or our identities and our cultures, they might not be as effective. And I think this is sort of a trend in health promotion in general, where queer populations are just erased because they should be like everyone else. But I don't really think they are. Yeah. I think that it's also good to recognize that bisexual men are, almost non-existent. They're really not mentioned very much at all in many of the studies, and even when they are, I think only 2 of the actual studies that mentioned bisexual men talked about how the results were applicable to them as a specific community, and queer trans men, only 2 studies as well were even mentioned, and I think that's pretty horrific, and I don't like that our community has become so sort of homogenized. So. Another thing that I sort of looked at was how many studies sort of actually talked about the demographic characteristics of the populations they looked at. And, like lots of them talked about sexual orientation, and then the list goes on. Fewer and fewer talked about race, ethnicity, education, income, place of birth, whether the men were rural or urban. And the biggest problem to me with this is that, with only one exception, none of the studies actually reflected on the generalizability of their findings or the validity of their findings, right? So if we neglect to discuss those, the generalizability, then what we're doing is we're overgeneralizing about gay, bi, MSM men, and we're not picking up the nuanced differences in our communities, our lives, our experiences, and our behaviors. So then I did sort of a focused analysis. And I just wanted to sort of pull out a few main points from that. So in terms of sort of specific populations of MSM, 6 abstracts exclusively focused on specific populations within men who have sex with men, and they're listed here. So this is in the past 2 years. 4 abstracts mentioned Aboriginal or Métis men, but none of them exclusively. 8 abstracts focused exclusively on HIV-positive men, and 3 abstracts focused exclusively on HIV-negative MSM. So if you think about it, that's pretty horrific. 1.2% of all of the abstracts over 2 years of the CAHR conference exclusively address the population that comprises 51% of the HIV epidemic. I also noticed what wasn't there. So there were no abstracts that mentioned East Asian MSM, Middle Eastern MSM, MSM labeled or living with disabilities, refugee MSM, queer trans men. So there were queer trans men's sort of research projects in the conference, but none in the past 2 years. So, I guess the question that we have to ask is this enough? Like, is this good enough for us? Do we like this? I don't, obviously. So then I did a little bit of a thematic analysis. We're getting close to the end. I think I have a minute left. So, I think that, what I wanted to say, sort of my overall feeling about what the abstracts talked about and how gay, bi, MSM and HIV research happens, is that really a lot of it talks about how much HIV and STIs do we have? What are we doing to get HIV and STIs, which is having unprotected sex? And what are the things in our lives that are making us do bad things that make us really sick? Right? And there was generally like a lot of model of pathology in a lot of these sort of discussions. Topics like love, desire for connection, sexual pleasure, sense of community, the relationship between our identities and sex, those things were basically ignored in CAHR conference abstracts. And I know, like, for myself, when I think about my sex life, HIV is obviously a huge part, but there's so much more that that goes into my decisions around my sex, that was totally missing, and it really sort of makes me feel like I am, diseased, and that I make really bad decisions. And maybe sometimes I do, maybe sometimes I don't. And another thing is, beyond, like, most of the abstracts did not really talk about how medical professionals are responsible for HIV and addressing HIV. So a few concluding thoughts. Based on the research, it's really hard to imagine evidence-based holistic health promotion programs that approach gay, bi, MSM men as whole people with cultures, values, communities, families, and professional lives. The dearth and complexity in volume and research among gay, bi, MSM men prevents a nuanced understanding of the dynamics of HIV, STIs, and other health disparities. And we are a diverse group, and we need research that reflects our diversity rather than blurs it. That's it. Thank you very much.